In this segment, we're going to be talking about internal parasite management. So, with this, we have the parasites, and all these guys can cause you production problems, usually in the form of weight loss and potentially death. So, talking about the first one, which is gastrointestinal worms, and this is your roundworms, your nematodes, and your stomach worms. Typically, what you're going to probably run into problems with is your stomach worms. Hermatius contortus, which is also known as the barber pole worm or wireworm. It gets its name for its appearance, as it looks like a striped barber pole after eating blood. This parasite causes the most problems in warm, moist climates like we have here in the south. It is a bloodsucker that pierces the lining of the abomasum, which is the sheep's fourth true stomach, and it causes blood, plasma, and protein loss to the sheep. Bad enough infestation can cause death. The FAMASA system was developed to detect infestations of this particular worm, and we will go through and actually demonstrate FAMASA scoring, just because it is how you can detect the anemia in the sheep, and that is the most commonly associated symptom with the barber pole worm infestation. And that's the pale mucous membranes, especially the lower eyelid and bottle jaw, which is an accumulation of fluid or swelling under the jaw. Most of the other worm species for the gastrointestinal worms are more likely to cause diarrhea. Your tapeworms, you can see these segments in the sheep and goat feces. It also tends to cause alarm in the producers, as they're like, oh my gosh, I've got a worm infestation. Generally, there's little evidence to suggest that treatment is beneficial to the host, although dramatically large numbers of tapeworms can occupy the small intestine, but don't do as much damage as the barber pole worm. Only certain anophthalmics or wormers are effective against the tapeworms, and those are listed there. Your lungworms, these can be found typically in wet, low-lying pastures with cool, damp weather. Only severe infestations cause clinical signs and generally include fever, coughing, nasal discharge, rapid breathing, and poor performance. Secondary infection may cause death. Liver flukes can cause death in sheep or goats in subacute cases. Typically, these are a concern in California, the Gulf Coast states, and the Pacific Northwest. Snails are the intermediate host, and if you have a really wet spring and you notice a lot of snails, you may want to start watching your flock for the potential for liver flukes. There are 2 drugs available in the U.S. for treatment of liver flukes. One is Corlison, and the other is albendazole. Your meningeal worm, this is deer or brain worm, is typically an internal parasite of white-tailed deer. Sheep are a dead-end host for the parasite, and again, slugs or snails are the intermediate host for this particular parasite. What it does, it moves into the brain and our spinal cord and causes fatal neurological disease. You may notice they have a slight limp or weakness in one or both legs. For mild infections, while in a severe infection, you may cause the animal to be partially or completely paralyzed. So again, this ties into lameness. Don't just shrug off lameness as being a little bit of a hoof problem or a muscle injury, because it could be signs of a bigger problem going on with your animal. When you're dealing with parasites, an integrated parasite management protocol is your best method for managing them. Generally, good management and common sense are the foundation to an internal parasite control. Don't feed the animals on ground. That's where most of your larvae reside at. And so if you're feeding the animals on the ground, they're more likely to pick up the larvae. Use feeders which cannot be contaminated by feces. Now that may not be absolutely entirely possible, especially with goats, because they like to get into everything, on everything, through everything, etc. Water needs to be kept clean of fecal matter. So if you go out and you notice your troughs have fecal matter in it, because, well, they poop wherever they're standing, and that's not always ideal because they're standing next to the water troughs or the feed troughs. Do not overstock, and that goes with any animal. Don't overstock. One, for parasite control, and two, your grass will really, and your forage will really appreciate not being overgrazed. Anytime you get new animals, they should be isolated from the rest of the flock for at least 30 days. And during this time, you want to get a fecal egg count done. That way you know if they are wormy. You don't want to just go randomly worming just because you got new sheep. They may not need it. And then you develop resistance to the wormers, which is worse than if you'd done nothing to begin with. So do a fecal egg count, find out if they are in fact infested with worms, and if they are, you can target which worms you actually have in the fecal egg count. You want to use clean or safe pastures, and these are pastures that have not been contaminated with worm larvae. And you can accomplish this by not grazing with the animals for the past 6 to 12 months, or you can use multi-species grazing. In other words, have your horses and cattle come in and graze those pastures after the sheep have left. Or if you've grown crops and tilled it, there's a couple of ways in here to make clean or safe pastures. Pasture rotation. One, it's good for your grass. Two, it's good to help kill off your larvae. It won't get rid of all of them, but it will significantly reduce the worm load on that pasture. In your grazing strategy, approximately 80% of your worm larvae can be found in the first 2 inches of grass. Don't overgraze. Leave at least 4 inches. When they're grazing taller grass, they're less likely to pick up the parasites. Multi-species grazing help because the internal parasites that affect the sheep and goats is not the same internal parasites that affect the horses and cattle. They may consume them, but they'll kill them. So rotating and doing multi-species grazing is a way to manage for parasites. This is probably a hot topic depending upon which forums you follow, but parasite resistance is hereditary. So if you keep track of who you're having to worm and how often you're having to worm them, you can start eliminating, start culling for the ones that are always needing to be wormed. I have right now, out of my flock of 33, I've had 4 individuals that I've had to worm in the last year, almost a year and a half now. And of that, none of them have been repeat offenders. If I'd had any that had been repeat offenders, and depending upon how far apart they had to be wormed, they would probably be going to be processed. That way I can get them out of the genetic pool. There's some resources up here for you to go to. Wormex has a lot of good information, and so does the research station out there at San Angelo for the extension. They have quite a bit of information on parasite management, parasite control, kind of anything parasite you can think of. They've got a lot of information out there on it. So at this task, what we're going to be doing is checking the hemolysis score of the sheep. This is used to help determine if I've got a heavy worm load. Primarily the barber pole worm is one of the ones that primarily affect the sheep. I'm not saying that you can't get tapeworms, roundworms, and some of the others, but the primary one affecting the sheep is the barber pole, and it will cause anemia. So what they do is they attach to the intestines of the sheep and they suck the blood. What this is, we're going to perform a hemolysis, which is technique. You'll push in on the upper eyelid and then pop out the lower eyelid, and you're looking at, just like this card shows, you're looking at that bottom eyelid. You need to do this in the sunlight, that way you can get an accurate reading on this. If you do it in the shade, the color won't be quite the same, and so you may be off on your reading. To do this, you just take the card up here, look at the eyelid, and look at the color scale on here. Looking at him, he's probably a 2, borderline 1, which means we Alright, so for this demonstration of the task, we're demonstrating how to do drenching. And this is something that you may need to do to give worming medication or oral medications. Whenever you do, make sure you get the weight of the animal, because all the dosing is based on the weight of the animal. For this one, we're using liquid vitamin B12. She's in good health, doesn't need anything right now, but it doesn't hurt to give a little bit of additional vitamin B for them. Whenever you drench, you're going to be putting your hand under the bottom of the jaw so you can tilt the head up. This will put it into the proper position so that when you put the drencher in, you're able to get it to the back of the throat, and that way they're swallowing the medication rather than able to spit it back out. You just don't want to fight them too badly and potentially injure them. Just like that, to the back, and squirt it in.